At this point, okay, I'm down to his hands. I can either go to his legs, but to me, I like to start in his thoracic cavity. Okay, so Anthony, at this point, I'm going to go ahead and auscultate your heart. Okay, no heart history, right? Nothing in the family. I'm not going to get in detail because it's a head to toe. Okay, I only have 10 to 15 minutes to do this. So at this point, you don't put the stethoscope. Wow, this is tight. You don't actually put the stethoscope into your ears because I can't hear what you're hearing anyways, and I want you to voice what you should be hearing. So Tim, I'm going to start off by listening to the aortic valve. It's the second intercostal space, just lateral to the sternal border on the right side. Listen for 3 or 4 beats. Lub-dub, 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 normal. I repeat listening for 3 to 4 beats in the other valves. The second intercostal space, just lateral to the sternal border on the left side, is the pulmonic valve. The third or fourth intercostal space on the left side, just lateral sternal border, is a tricuspid valve. I could also hear that over here on the right side or over top of his xiphoid process. Okay? And then I would listen to the apical for 1 full minute. Okay? During that time, after listening to the apical, I will check for a pulse deficit. Make sure that every time I hear a lub-dub, I feel 1 pulsation in his radio. I can do that left or right wrist. It doesn't make a difference. Okay? And then repeat this assessment, listening for murmurs with the bell of the stethoscope. Aortic, pulmonic, again 3 or 4 beats. I'm just listening for murmurs, which would be a swishing sound caused by turbulent blood flow through a valve. Okay. Cardiac assessment done. That's all there is to that. Okay. You guys would actually listen for a minute. Okay, as I told you to go faster. At this point, I'm still on a thoracic cavity. What else I have to listen to? His lungs. I'll listen to his lungs here. Okay. So at this point, Anthony, I'm going to have you take deep breaths. Excuse me. Take deep breaths in through your nose, out through your mouth, as I auscultate and listen for normal lung sounds. Okay? Again, no breathing problem, all right? Okay. So, start above the clavicle, and deep breath in, and out, in through your nose, out through your mouth. Good, and I want you to blow it out. Good. Breathe normal. At this point, I would tell him to breathe normal. I don't want to take too many deep breaths. You guys, I just want to see the assessment technique at this point. I want to see that you know to tell him to breathe with each breath, but I don't want your peers passing it out on us, okay? So this is what kind of breath sound? Bronchial. I come down here, it's bronchiovesicular. I'm doing the latter pattern comparing for symmetry, bronchiovesicular. And at this point, as soon as I do my third one down, it's vesicular. 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 You notice there's only 1 finger width between each diaphragm. It's not here, then here, right? Here, 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 here. I'm feeling for his ribs. I want to go to them. Here, here. Flip your arms. Here, 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 and here. Okay? I listened for normal vowel sounds. I might ask you a question. Tell me 1 adventitious sound. I don't know. You say, well, I remember crackles, bronchi. And then I'll ask you, well, explain what would cause bronchi. And he says, bronchi is caused by mucus production. Okay? If I cough, it may disappear. Sounds like a rumbling, a loud, firm noise. Okay. I repeat on the backside the same exact assessment technique, except for I avoid the scapulae, right? So in through the nose, out through the mouth. And again. Okay, and I start off with bronchiovesicular right away, and then I move right into vesicular. And just breathe normal. I'm just going to show proper pattern, okay, or technique. Stand up so they can actually see. Okay? In through the nose, out through the mouth, each place. Again, on a real patient, I'd probably integrate that into my cardiac assessment. Okay?
Could you do another side?
What's that?
Another side, you can see it over here. I'm sorry.
What are you, the producer?
So what are you supposed to hear if, like, nothing's wrong with their lungs? Like,
You're supposed to hear the bronchial sounds, bronchiovesicular sounds, and vesicular sounds. Those are normal lung sounds. Sorry for speaking.
so if you don't hear it, are they not, like...
Well, you're going to hear sound. You're going to hear air moving through them. You're definitely going to hear that.